Hi, I'm Dr. and author Chris Willard, and I just want to share with you a few brief mind-body practices and mindfulness practices that can help you and your clients to regulate your mind, your body, your emotions, and even your impulses. Now, I learned recently that we have close to 100,000 thoughts a day, all swirling around in our minds, just like the glitter in this jar, making it hard to see or think clearly at all. And for our clients who are maybe struggling with anxiety, with depression, or with trauma, we know that most of these thoughts are going to be pretty negative, pretty unpleasant, often even pretty terrifying, and certainly not always so accurate. So what I want to share with you are a few ways we can help our clients just settle their minds, not to get rid of their thoughts, but just to be able to see things a bit more clearly, a bit more accurately in the course of day-to-day life. So with that, I'd like to introduce you to a short practice I learned over the years. It's an acronym HALT, and it simply stands for a little mind-body check-in with yourself. You can ask yourself, are you hungry? Are you angry or anxious? Are you feeling lonely? And lastly, are you tired? And then what can you do about those things? So let's start by checking in right now. Are you feeling hungry? Because if we're feeling hungry, if our blood sugar is low, we know that's going to depress our mood and our client's mood. We're also not getting enough glucose into the prefrontal cortex where we think things through, where we control our impulses, where we see things a bit more clearly, and where we're really able to do our focusing and have our executive functions. So being hungry means that we're really losing our mind, not able to think so straight. So we can help our clients with this a little bit with this simple acronym. Secondly, A stands for angry or anxious. These are basically representative of our fight and flight response, how we feel when we're stressed out. And when we're angry or we're anxious, cortisol is coursing through us, and we'll talk about how to deal with that in a moment. But it's also shutting off our prefrontal cortex, again, where we think things through, shutting off our insular cortex, where we take other people's perspective, where we have empathy, where we understand where other people are coming from. And so we're really certainly not at our best because our amygdala's turned on, telling us that everything looks like a danger and really giving us an inaccurate perception of what's happening in the world around us. Next, we turn toward L, lonely. Now, one old saying we have, of course, is, right, if your mind is a dangerous neighborhood, don't go there alone. Right? That's the job of us therapists, to accompany our clients and our patients when their mind is a dangerous neighborhood. So it's encouraging them to reach out, to not be so disconnected, to help them build and maintain that network of support. Because we know also from the research on positive psychology that when our clients have more emotional and social support from people around them in a network, they're going to be happier, their mood's going to be better, even their physical health is going to be better when they're not so lonely. Lastly, the T stands for tired. Now, what happens when we're tired at the end of a long day, right? Our willpower shuts down, our prefrontal cortex again shuts down, can't think things through, can't focus, can't manage our impulses or even regulate our emotions so well. And what else is happening even after a night of not so good sleep, which we know so many of our clients are struggling with, is we're actually almost losing a few IQ points for each hour that we're not getting sleep at night. So our clients are really not at their best in terms of learning how to take care of themselves and do the work that they need to do in therapy when they're feeling tired. So it's a simple acronym for both ourselves and to share with our clients. Just check in every so often. Are you feeling hungry? Are you feeling angry or anxious? Are you feeling lonely? Are you feeling tired? What perhaps can you do about that? Now, there's some simple things we can do for hungry and lonely, and maybe even for tired. Right? But for angry and anxious, what can we do? Well, this is where some mind-body settling techniques can be helpful. And so maybe if we have that cortisol coursing through us, that our clients, maybe they want to shake it out. Right? Shake out one hand, shake out the other hand, shake out your head, shake out your feet, shake out your other feet. This actually helps loosen up cortisol throughout the system. It's what animals do after they've been stressed out. That's why they don't develop PTSD in quite the same way humans do. And then just stop, just like we've shaken up the jar, and allow yourself to settle. Feeling your hair settling on the top of your head. And your eyelids settled on top of each other. And your tongue, lips settled in your mouth. And the sensations of your hands settling in your lap. Your back and legs settling on the chair. Lastly, your feet settled on the floor. Scanning back up through your body. Allowing your eyes to open. Maybe even finding yourself just a bit more settled, a bit more clear, just like the glitter in the jar. So these are just a few simple practices you can use yourself, share with your clients when they're struggling. The HALT, hungry, angry, lonely, and tired, just a real simple mindful check-in. Or this shake it off and then settle it down practice. It really helps us settle in, ground ourselves, help our clients ground themselves in the course of day-to-day life when they're feeling a little bit overwhelmed, agitated, and activated with anger or anxiety. So I hope you found these couple of practices helpful. You can find so many more like this in the Making Mindfulness Fit course that I'm offering in partnership with PESI. Hope to see you there.